Hi, I'm Caley Shukalek. I'm a physician and a clinical assistant professor here at the University of Calgary and the Chief Medical Officer for PurposeMed. I'm particularly interested in sexual health and specifically as it relates to sexually transmitted bloodborne infections. So HIV, syphilis, gonorrhea, chlamydia, both prevention and treatment of all those things. And I typically work in implementation science, or how do we actually get these things out to the people, which has led to some of the other things I do. So a lot of my clinical work and research involves the 2SLGBTQI community. As a gay man, I resonate and I really feel a part of that community and feel a need to contribute. It's definitely an area that I've focused my work on, both in sexual health medicine as well as in research. PurposeMed is a virtual health company that seeks to create access to healthcare for underserved populations and underserved conditions, and notably complex health conditions. So our first brand was Freddie. We launched in 2020. Freddie is there for anyone and everyone who needs access to HIV prevention, and we've actually started to do some HIV care as well, understanding that it's not just one side of that coin, that we really do need to address both. And then we have Frida, which launched in early 2022. And Frida is around mental health. Adult ADHD had a lack of access and a lack of providers who are truly aware about providing care to diagnose and to treat. Myself having ADHD, it kind of spoke to me. And most recently, we've launched Foria in mid-2023. And Foria specializes in trans health, gender-affirming care for the communities. And we operate each of these services in various provinces and seeking to have it really a complete national and actually bridging into the US already with Freddie. And so really expanding our services to everywhere we know that they are needed. I know that access is an issue to HIV prevention and just general sexual health. And in particular for what I'm going to refer to as a queer community. I've experienced stigma as a gay man in the healthcare setting. And I'm a health professional and very health literate. And I know that if I'm experiencing it, then everyone else is. Wanting to really create that was what founded Freddie. And creating this way that patients themselves can just through a click of a button on their phone, on their computer, whatever, they can access a health provider who, truly understands them, wants to provide them the best care possible, in no matter where they live. Similar things with mental health, right? We know there's a lack of access, and maybe even more so than typical mental health. When PurposeMed was, an idea, UCalgary, which is affiliated and part of Innovate Calgary, was aware of PurposeMed. We submitted applications for funding and were successful in getting some seed funding as a very small company. And as in that really baby startup phase of any company, money matters. So having that seed funding from UCalgary and Innovate Calgary was so instrumental to us being able to even just start and really grow to a size where we could make our own revenues. I think it's helped us be successful in receiving so much more support. I think my first advice is beware it's going to be a lot of work, but if you're, an academic or a physician or clinician academic, you already know that you have to work hard to, chase your dreams. If you have a passion, though, it's going to be so worth it. If you have an idea and you don't know where to start, there are a lot of spaces at the university, your local academic institution, or your local kind of tech hub or starter is going to be a great place to go look for those conversations or those people to help you grow. Get a lawyer. Make sure you protect your property, your intellectual property as best you can, and put the effort in, and hope you have a little bit of luck to go with it.